most famous physical therapist on the internet.
Hi, folks. I'm Bob Sharp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course,
A
Bob.
little demented and sad to think that. Today we're going to talk about the Cornish method to reduce swelling in your legs.
Like a Cornish hen.
No, this is Dr. Cornish.
Ah.
We're going to talk about this in just a second. By the way, if you are new to our channel, please subscribe to us. We provide videos on Stay Healthy, Fit, Pain Free, and we upload every day.
Every day.
Also, go to bobandbrad.com and go to the giveaway section. We're always giving something away. This week, we're going to give away some of our wall anchors.
There you go.
So, Brad, I was contacted by Cornish, PhD. He was a cardiovascular physiologist.
Sure.
And professor at the University of Nebraska.
You can't go wrong in Nebraska. They got a lot of corn there.
Yeah, Omaha. So for 37 years, anyway.
It's kind of interesting. There's a lot of corn there, and his name is Cornish. Take the ISH off. That's probably how he got there.
Very good.
We better get on. He'll get mad at me.
All right. So he had an anterior hip replacement.
Yep.
He had trouble with swelling in his upper thigh to his knee.
Yep.
Very common. He tried ice, and it did nothing.
Right.
And
right.
I agree with this 100%.
Yeah, for
ice,
edema, I don't think it's going to hurt anything, but it...
Well, I think it'll stop it from getting worse. Okay. It constricts your arteries and veins and lymphatics, so it stops it from getting worse, but it does nothing to remove the fluid.
Sure.
So, and he being a smart guy and knowing what he's doing, he had an inversion table, I believe.
Wow, that's what this is, yeah.
And he set it up for 15 degrees. Let me warn you right away, though. I don't want you doing any of these methods unless you check with your doctor first, because there's some people who should not be doing inversion, and we don't want you to blame us.
Well, we don't want you to get hurt, have some health problems. And we're only going 15 degrees. It's not very much, but still, if you've got some cardiac problems or some other issues
you can flood your system.
Yeah, it could be a problem.
But he only went 15 degrees, which was not pressure on his hip either. So he was able to tolerate that very well. Brad, why don't you get into the device right now? And we have a teeter table here. Is that what it's called? Teeter inversion table?
Yeah, TEETER. And actually, that's the name of the guy who invented. Yeah. Well, he didn't invert inversion tables, but he produces these in his company.
I find that amazing that a guy named Teeter invented like a teeter-totter.
Yeah, and that's kind of like what this is. So it was meant to be.
So Brad has locked his legs in place.
Yep.
And now what do you do, Brad?
Okay, once you set this up, we're not going to go through how to set it up. I've already adjusted. There's adjustments here and adjustments here. And once you get this up, you should be able to go back very controllably. And just by changing my hands like this to here, I can change whether or not I want to go up to this position.
Yeah, he's got a strap underneath the device here.
Right.
And it's set at 15 degrees. So you can see 15 degrees is not very far. So Dr. Cornish, what he did, when he first did this, he did some muscle contraction too. But he got bored with that, so he stopped. He lied there for 30 minutes, and after 30 minutes, the edema had gone down 1 inch.
Just from gravity?
Right, just from gravity.
Yeah.
So, you can get a table for not that much of amount. And, if you're having trouble with your back and you want to try this for that too, I'm definitely going to be an advocate of this.
Right.
I don't know if I'd get this just for edema after a surgery.
No, because you could raise the foot of your bed up and, get that 15 degrees, which isn't a lot, but you're not going to sleep like that all night long.
Right. So, yeah, options. Can you put your legs up on pillows? Well, the problem with that is the lymphedema, the edema has to travel from the leg, go all the way up to the chest, where it actually goes into the venous system, goes into the thoracic venous system. So if it gets caught, if your legs are bent.
Yeah, if your hips are flexed, if you just put the pillows underneath your legs, your hips will flex.
Right.
And that kind of creates a dam, so to speak, right in your lymph node area in their femoral crease. Is that correct?
It can stop the edema from traveling all the way up. So, yeah, you could raise the foot of your bed up put some blocks underneath. And you were talking about sine and cosine. I don't know what you're talking about, but as far as the formula for how far you put it
Right.
up.
I'm sure you could Google it, but I would say if you raise the end, we should have. I should have figured this out before the video. Probably
Sure.
6 inches would be enough.
And again, though, I wouldn't go past 30 minutes. So
Right.
it'd be a little bit of a hassle to
Yeah,
do
you,
that
you
every
got to
time.
set your timer or alarm because if you fall asleep and are there for a couple hours, that's not desirable. We want to stick to 30 minutes. So,
Now, if you have complications from chronic edema, this is maybe something you want to consider because I'm going to read some of the complications, Brad.
okay.
So there's painful swelling, difficult walking, stiffness, stretched skin, which can become itchy and uncomfortable. I've seen the skin break down, haven't you?
Yeah, we're actually weeps.
Yes.
Yeah, and that's
Actually, it's like your clothes become all wet from
yeah.
weeping.
You really got to have a doctor along with you on that.
Scarring between the layers of tissues, decreased blood circulation. He was talking about compartment syndrome.
Oh yeah.
It could happen, especially in the lower compartments here. Decreased elasticity of the arteries, veins, joints, and muscles, and increased risk of skin ulcers. That's what we're talking about, skin
Sure.
ulcers.
Yeah.
So, I don't know if I'd get a table just for after surgery
Right.
for
Right.
an issue like that. But if you have chronic edema, this might be the answer to you. And
Yeah.
plus, you're going to stretch out your back a little bit too.
Yeah, I
A
can
little-
feel it now. We
so-
do have some videos on how to use an inversion table for back pain because typically you go more than 15 degrees for your back. But
Yeah, some people go all the way. In fact, which
Yeah,
I wouldn't recommend.
I don't recommend it either, but I know they do it.
Brad did this. He used a table for years, right?
I had it for about a year and a half, 2 years, and it helped initially.
And
And
then
then I
stopped
wasn't
helping.
getting relief, and I got spondylolisthesis. Whatever, you're only going to do this if it feels good. If you have
Right.
problems, if you have eye problems, you have to be careful because
Yes.
that increases pressure in your eyes, and that's something you need to talk to your doctor about. Most people are, if you're a healthy person in general, you don't have a heart problem, you don't have any eye problems, you're probably going to be fine doing it. But don't invert all the way right away for sure. You really got to work into it slowly.
So this is an example again, Brad, where I think it's really cool where our audience jumped in and participated and gave us some helpful information
Right.
that we never would have found out on our own.
Yeah.
So
And this is one of those things that obviously done by a PhD. He's very
well,
familiar.
he taught on lymphedema.
Right. Yeah, that was his subject. So, but this is not out there. I think
No.
it's not like
the
it probably
Cornish
will
method,
be.
the Cornish
Yeah,
method.
exactly.
We started it right here.
Thank you, Dr.
Thanks for watching.
Cornish.
Yep. Thank you, Dr. Cornish.